So I think that my biggest challenge has been actually sort of figuring out how to traverse all the silos, because there are so many different silos, not only within our hospital, but there's also, okay, that's a Care Oregon patient, that's an Aetna patient, that's this patient, and actually finding the resources for those folks. Like, I have a limited number of scales that I can give up to patients. I love it when they're Care Oregon patients because they actually already recognize that that's really an important need, and those patients need scales. So I call somebody up, and the next thing I know, at the patient's bedside is a scale. So for me, it's just been learning the different systems, because as soon as you think that you know about everything, then, well, what about this agency? Okay, I didn't know about that. So that's, I think, been a huge learning curve for myself. And just recognizing that all the patients are very different. And I think doing home visits, I don't think I said anything about this earlier, but I started doing home visits on our readmission patients, and that again was an eye-opening experience. And I'm like, of course they're coming in, now I totally get this. But that's been really important. Thank you.
I think I echo the same thing. I feel like we're all saying that transparency among all providers is critical. And I know for us, we feel like we've deployed the electronic health record, we've done all these studies, and we're kind of in this waiting game for other providers to fold us into the loop. So we're waiting to see what the hospitals do, we're waiting to see what physician clinics are going to do, and how are we going to be part of that continuum of care? How will they fold us in? And so I think that's one of the biggest barriers, is just the lack of transparency and defining who the driver is going to be, and how each stakeholder is going to be represented. I think also what needs to be recognized that we see as a critical concern is just the competitive nature. At the end of the day, everybody needs to be successful, and they need to be financially successful. They need to be, successful from a quality outcomes perspective. And I think there's a lot of positioning that's going on. And so while we call for transparency, I know just in myself what I want to release as far as all of the studies that we've done. I hold it a little bit close to the vest because my competition is also trying to get themselves placed, and I know that each hospital system is doing the same thing. And while everybody talks about what we're all doing this, I know that I've met with every single hospital system in the city of Portland and given them our information, and every hospital is going about this a different way. And so, I think, again, trying to establish who's going to drive these initiatives, what are the standards going to be, so that we can all get ourselves in a line. And if at the end it becomes a competitive, we're at least knowing what we're being measured up against and can get ourselves prepared for it. And I think until there is a driver and the stakeholders are identified, it's going to be hard, and we're all going to be in these work groups. And I worry, I think our group talked earlier today about these work groups, and then and I'm not saying Q Corp is going to be one of them, but that a lot of work is done all for naught, and it gets put on the shelf, and there's been, a great amount of time consumed in defining what the needs are, but the solution, a viable, long-term, sustainable solution, is never really truly reached. And I think that's one of our biggest goals in doing this today, is to figure out how can we find something that's going to be viable for all of the players in the healthcare continuum.
Thank you, Kathy. Good point.
Well, there's a reason why we all learn to work in silos. Working in silos is a lot easier, and it moves a lot faster when we decide this is what needs to be done and we're going to go do it. Collaboration is slower, it has more frustrations, it's more complicated, but it's also absolutely essential. I should add, I neglected, I think, to mention some of the most key components of our team. In addition to all the provider organizations, we also had a patient on our team. We had a family member on our team who really struggled to try and come to meetings and manage her life. And we had our local AAA agency on our team, which was really important. And those were really critical, I think, aspects of what we were trying to do. But collaboration is not just nice, it's hard. And people have to be willing to stay at the table. Now, we had a group that really wanted to be there. We did a very good job, I think, of keeping people at the table. But it takes commitment, and you have to be able to listen to the other person's perspective over a period of time. So that's, I think, a major challenge. Secondly, I think, is figuring out how to sustain what we're doing in the realities of day-to-day healthcare workflow. And whenever you add anything, particularly something that requires attentiveness and really engagement by both the provider and the patient, it's very disruptive to our existing workflow. And when we tested the personal health record in all of the settings I mentioned, one of the biggest challenges is how to add even as important a component as that into standard work. So it has to replace something. So one of the reasons why we chose the particular tool we did is that it supported TeachBack, it supported MedRec, and all these other things that need to be core parts of the workflow. And then sort of associated with that, I think, is, we talk a lot about patient engagement. We really, I think, won't have as big a problem with patient engagement once we have provider engagement and provider organization engagement in some of these endeavors. And that's what we're finding is that patients, we're very receptive to the idea of using a tool like a personal health record, but it's only going to be sustainable for them as long as their providers take an interest in it and use it. And that's our next big challenge, is really to disseminate it to market and to help providers figure out a way how they can use it.
In the interest of time, and it is running short, I do want to leave time for a couple of questions. Let me ask the panel if you have any concluding comments. And Dan, I'll stay with you and kind of work back this direction. Where the last question I would ask you is there anything that you have a sense of optimism about when you look at the future as based on the past working in this arena?
No good crisis should go unwasted. And certainly we're there, and I think it does present the opportunity for a lot of change, and a lot of what we've discussed here, frankly, is not all that new. We're learning all the time, but a lot of the core elements that we've talked about here, we've been learning about for over a decade now, and we're now but we've never had a way to align incentives to implement what we all know needs to happen, and I think we're closer to that now than we ever have been. And I would also say that, again, the desire on the part, in terms of our community, which I think is no different than most, the desire of healthcare professionals and of patients to find a better way and work together is there. And I think if you give them the opportunity, they're going to take advantage of it.
Nicely said. Thank you. Kathy?
Well, I would mirror that. I think that, at the end of the day, I think if we can come to a good solution, a viable solution, it will be, in the best interest of the patients that we're serving. And I think that, often we get in these silos and we forget at the end of the day that that's, really what we need to be there for. And I do believe that all of this work will help to benefit the outcome for the patients and them being better prepared to make decisions. And I also think there is a lot of waste in our system. I think each one of us would, can certainly identify financial waste that goes on in the way we deliver care currently. And I think this is an opportunity for us to streamline some of that and create efficiencies.
Thank you, Jane.
I feel very optimistic. I feel thankful that finally some of these issues that have been around for decades that we're finally addressing, and I think it's great for the patients, the families, the providers, everybody, because I think people have been frustrated with the system for a long time. So I'm very optimistic.
Rebecca?
I'm really optimistic as well, and I think I don't mean to come back to financial incentives over and over again, but I think given where I sit, it's really nice to see that there are so many more opportunities now in terms of aligned incentives that, primary care, we know that primary care has been underfunded in our communities and in our country, and now we're seeing healthcare reform shifts such that medical homes or primary care clinics that are wanting to become medical homes are now looking at, they may actually be somewhat accountable for preventing avoidable admissions and readmissions in their population. And because they haven't had really enough funding to do even just the basic care for, especially in the safety net environment, they're now looking at, shifting in incentives is allowing them, and really I'm seeing so much more interest now in, can you send us lists every week of our patients that have been in the emergency department and that have been in the hospital. Now they don't have that coming directly from them yet, from hospitals and EDs. So we're sending it to them, and there'll be a little bit of a lag. But the great thing is that they're seeing this pattern of utilization for their patients, and they want to change it, and they feel like they have some leverage now to really to change those outcomes for their patients. So I feel like given the change with healthcare reform and the incentives, that there's a lot more opportunities for us to collaborate and work together to find a solution. So.
And I'll just echo a lot of what's been said, but and add, as part of our work, we did a qualitative evaluation where we did focus groups with varied aspects of our care team, from Care Oregon leadership and caseworkers and case managers, to social workers, to outpatient providers, inpatient providers, administrators, the whole gamut. And one of the things that we learned in our analysis of that was that there's really a widespread, I think very deep sense of professionalism and sense of duty about providing high quality care and doing it in a coordinated and effective way. And we really found that amongst these disparate groups. So to me, that really suggests that it's that there's a big opportunity, and really focusing on the patient safety and the patient outcomes. And then the last thing I would say in terms of my sense of hope for the future about this is that I think that a lot of these issues really are systems problems and require systems change. And so I think having leadership and a vision for that is hopeful. So it's back to Q-Core's goal.
Thank you very much. Can we entertain any questions from the audience or comments? You guys all need a cookie, right? Well, I want to thank our panel. Thank you very much.